On behalf of the Egyptian Society of Radiology and Nuclear Medicine, I would like to thank the Royal College of Radiology for their very kind cooperation, particularly during the last couple of years. And now we are working to expand our cooperation to include education and training. So this will be the topic of this session. So my co-chair, Dr. Joanna Brown, will introduce the first speaker.
Thank you very much, Professor Tarek, for the introduction of the session. And together with Professor Tarek, I would like to welcome all of you to this RCR session. The Royal College of Radiologists that you will hear in a minute, it's involved in education and setting standards in the UK. And we came a bit earlier, and yesterday we had a series of meetings with the Egyptian Society and the Ministry of Health. And we really think that this will be our continuation and the next step in starting and developing further the radiation training in radiology in Egypt. But first of all, I would like to share with you what we are doing in the UK. And I would like to invite the first speaker. It's Professor Geeta Menon. And Professor Geeta is a very special person. She is not radiologist, she is ophthalmic surgeon, but she has a lot of radiology in her family because her husband and her son, they are both radiologists. But also what is really fantastic about Geeta, that she is involved in a lot of different programs, and she is a postgraduate dean in Health Education England, leading the training and education in radiology and looking after cancer services and diagnostic. So she is the person who is looking after our trainees, our trainers, and all of the training system. And she will now share with you her work and how does it work in UK. Yes, please, if you can come.
Hello, everybody. And I'm just going to give you a little overview of training in the UK. And unfortunately, I then have to leave. So I'm going to leave Tanya to answer some of the questions with Joanna. So I just thought we'd start with ST1 training. So radiology training is a run-through training program in the UK where you start at an ST1 level. You would have done your undergraduate medical degree, completed 2 years of what we call foundation program training in the UK, and then post-registration, you get your full GMC registration following your foundation training, and then you can start to apply for radiology. ST1 radiology applications are very highly sought after, so you have a ratio of 4 to 1. So there'll be at least 4 applicants to 1 ST1 job. And the other thing that we have started since last year is actually taking trainees at ST3 plus level. So this is a completely new way of bringing in trainees into radiology, because like I said previously, they used to only get ST1 recruitment. ST3 recruitment, they again need to have their medical degree. They have about 3 years medical experience post-registration. This could be in the UK or overseas, and need full registration with the GMC and FRCR Part 1. So the reason why we wanted to actually bring to your notice about the ST3 training or the entry is that, if you have done your training in Egypt, you've actually got your postgraduate degree in Egypt, and you then have got your Part 1 FRCR exam, then if you have PLAB, you become eligible to apply for ST3 plus training in the UK. Similarly, if you also have done your Part 1, done your Egyptian qualification, and then you have not got a PLAB exam, we have got a system in which we can look through PLAB exemption for this ST3 recruitment. So that's why we wanted to just bring it to your notice that this is a new criteria that we have introduced for ST3 recruitment. I'm not going to go through in detail all the eligibility criteria that are available on the Oriel website, but basically it's looking at the competencies you've achieved in your radiology training, which is equivalent to ST1-2 training in the UK, so that you can then get your Part 1 exams and start ST3 training. So just to go quickly through the recruitment process, it's an online application. I think most of you are aware because somebody was asking me, is it Oriel? Yes. So there's a long list for eligibility, which is pretty, they skim through all the paperwork you've sent to make sure it's kosher. And then you then have to take what is called the MSRA, which is a multi-specialty recruitment assessment test that is given. And once that is done, they rank based on the score. And the top 600 candidates are then invited to interview. So important to remember that, the MSRA criteria is what gives you the rank to actually get into, get an interview for ST1 or ST3 training for that matter, because it's the same process. Then you have an online interview process. Since the pandemic, this is how we've now changed our interview system. The interview score is then added to your MSRA score, and then applicants are ranked, and then applicants will preference the available posts, and offers will be then circulated based on the rank and preference. The offers are accepted, and then the employing deaneries do the pre-employment check and the post starts. The training in the UK, like I was just talking to you about, was the minimum requirement is that foundation training, so F1 and F2. But like I said, if you've done your postgraduate training already in Egypt, then you discount all of that. ST1 to 3 is what we call core training. And after ST1 to 3, there's a critical progression point where you then enter what is called specialist interest training. And here is where you separate into, what different subspecialty you want to train in radiology. So the ST4 and 5 years are for your specialty interest in the specific specialty. If you wanted to do intervention radiology, there are 2 ways it happens. So since last year, you can actually start at ST1 to train in intervention radiology. You decide you want to do intervention radiology, you can actually start at ST1. There are about 15 to 20 posts in the country that trainees can actually opt for. If you actually have started your diagnostic training and you then want to do intervention radiology, again, you finish your core radiology training the first 3 years, and then you branch out from ST4 year into intervention radiology training. So your 4, 5, and 6 are intervention radiology. And this training with intervention radiology is as you're doing the general radiology skills as well. So it's both at the same time, and that's why you have an extra year. The program of assessment, so there's, as you know, it's a competency-based program, and so it's based on a wide range of work-based assessments. This is defined by the curriculum, and the curriculum is actually written by the Royal College. So the RCR have developed the curriculum, and Health Education England is the body that actually implements that curriculum. So you have various, like I said, WBAs, which are direct observation procedure, image interpretation exercises, teaching observation, multi-source feedback, so feedback from all the people that you work with, quality improvement projects and audit. So we were standing at the RCR stand, and it was interesting to see that this is something that is a gap in Egypt. So, we were looking at how can we help, get the concept of quality improvement and audit into training. And then you have the multidisciplinary team assessment as well. Then you have the supervision. So, like Joanna was saying, we look after the trainees, but we also look after the trainers. So each trainee has got what is an educational supervisor. That is somebody who actually looks after the overall pastoral care of that trainee. And they meet with the trainee to develop a personal development plan for the trainee to make sure that they're on track for training. And then you have clinical supervisors who actually supervise you while you're at your workplace. So they have, and each time you rotate, you get a different clinical supervisor. usually the educational supervisor remains the same for the year you are in that hospital. And after each year, the clinical supervisors provide a report to the educational supervisor about the progression that the trainee has made. And this is what is called the annual progression report. And that then is produced by the educational supervisor, collating all the clinical supervisor reports into the educational supervisor report, which then is used for the annual review of competency progression. So every year there's an annual review that happens, which is called the ARCP process. The curriculum has changed now. The GMC has decided to now actually use levels of entrustability as opposed to just the workplace-based assessments. So there are defines the 4 levels of entrustability. So that is observe only, then you act under direct supervision, then you are actually acting with indirect or minimal supervision, and then you're actually acting unsupervised. So these are the 4 levels you would go through. So by the time you come to your ST5 training in diagnostic radiology, you would have actually reached that level 4, which is of entrustability. So that is, you're working independently at a level of equivalent to the consultant. And assessing progress, like I said, the curriculum details expected entrustability level for every, SIP and the procedure at every stage. So this is just to give you an idea about how that works. So, there's a specialty specific SIP here, and, you actually can see how you reach each level, starting at level 2 as an ST1, and then progressing to level 4 at ST5. And this is again to show you how the critical progression points in clinical radiology. I'm not going to go into all the details, but just to give you an idea about how assessment is quite important in the whole training program, because we are actually building this on competency-based training and not years. Like I said, every trainee has an annual review of competency progression, or the ARCP, to determine whether they can progress into their next indicative year of training. Assessment of evidence in the e-portfolio, primarily a structured report completed by the trainee's educational supervisor. And the process is run by Health Education England. We have a panel of supervisors and college tutors and others who actually these educators sit on the panel, look at the portfolio. I think Tanya will be touching on the portfolio, and then deciding whether the trainee has actually achieved that level to progress. RCR also have appointed what are called regional advisors, specialty advisors who act as external assessors on those panels. You also, as a trainee in the UK, get a chance to work out of program. So out of program opportunities, which is to broaden your experience. So your trainees can take time out where they can, access either training, become, trainers, trying to undertake research like MDs and PhDs, your higher degrees, or you might actually go and do a management program. So these are the ways in which you can actually take that time out of program in your training. Some of this can count towards your training. Some of this may not count towards your training. So if you're doing a research project, for example, and you're actually doing some clinical radiology at the same time, then that clinical radiology bit could count towards your training. And, doing fellowships. So intervention radiology have got, various fellowships they go and do when they go out of program. So out of program training, it's called. And so even outside the NHS, if you want, you can do that. It doesn't have to be necessarily, so you can take an out-of-program career break, which is an oopsie, and you can go and do something totally different. So this is just to give you an example of the regional structure. So you have Health Education England, London, so, and this is then you have a School of Radiology that sits underneath that, and then the School of Radiology has got the various training programs that are looked after by the training program directors. The other thing that we have also developed to improve training in diagnostics is the imaging academies. So, regionally, we now have 7 regions in England: London, Southeast, Southwest, East of England, Midlands, Northeastern Yorkshire, and Northwest. And what the imaging academies have done is it's actually allowed us to expand the training capacity in a more cost-effective way, using the faculty of educators that we have in a more cost-effective way as well. And there's greater geographic equity in the distribution of training. Multidisciplinary technology enhanced learning happens, and instead of actually duplicating the effort and reinventing the wheel, what you're trying to do is use all the really great examples and try and make sure that every trainee has access to all of it. So there are various learning platforms that we now use in the imaging academies, sharing all the learning material through the RCR. So, like I said, imaging academies, the other advantages that you're training multi-professionally. So, you can train all of the multi-professional team in the imaging academy. So not just radiologists and radiographers, but your sonographers, medical physicists, radiology nurses, imaging support workers, assistant practitioners, and mammographers. And the more important thing is that you can actually have a medical physicist training an ST1 trainee. So, giving them that safety training and the training in medical physics, which is quite important in your first year of training. So I think I'm going to stop there. I'm really sorry that I have to go and catch a flight. So I'm going to leave you with the group, but I'm very happy to answer questions by email. So if you can email, the organizers have got my email. So if you email me, very happy to answer questions. And I'm really sorry about this.
Thank you so much. Thank you.